Good afternoon. I'm really very honored by the opportunity to come here and to deliver the Alf Nachemson Lecture, which is a tribute to one of the champions in the area of evidence-based preventive medicine. But I'm also very enthusiastic about your invitation to comment on the organization and delivery of occupational health and safety services. And it's a special challenge to do this here in Ontario, where I have to acknowledge that I agree that the state of Washington is a pretty good place to do this kind of work, but I've got to acknowledge that your provincial programs here are among the very best in North America, and you're in the midst of a major effort to improve them further. As most of you know, in 2010, Tony Dean chaired an expert advisory panel charged with a review of the provincial occupational health and safety system. And the panel's report in December 2010 was followed by legislation amending the Act and by the subsequent appointment of the province's first chief prevention officer and recently the appointment of the new Prevention Council. When I read the Dean report and thinking about this lecture, it really struck me as a very visionary but at the same time practical blueprint for improvement. And I'd like to draw on four themes this afternoon from that report that will serve as a framework to my talk. The first is renewed attention to prevention as the organizing principle for occupational health and safety programs and the key to their success. The second is the recognition that the nature of workplaces, work, and the workforce has changed dramatically since the Act, the Safety and Health Act, was enacted, and that tackling the issues associated with this high degree of worker vulnerability in a changing workforce requires a multi-pronged approach. Third principle is the acknowledgement that while government can set standards, monitor performance, and enforce regulations, it cannot be in every workplace. And then the fourth principle is an emphasis on evidence-based changes that must be made in a manner that helps achieve measurable improvements. So with regard to the first theme of prevention, I began my career as a practicing physician in Boston, at Boston City Hospital. And I quickly learned that every treatment of a medical problem, no matter how successful, is in fact a missed opportunity, a failure to prevent. And that insight became especially clear to me when I was on the children's wards at Boston City in 1971, when children kept returning with repeat episodes of lead poisoning after being, quote, successfully treated. And I had a mentor at that time, a senior physician by the name of Dr. Robert Klein, who insisted that we ask ourselves not just how to treat the disease, but why it had occurred. And then to keep asking the question why until we reached an understanding of the deepest root cause that we could identify. Now, Dr. Klein's example was that children were getting sick because they were eating lead paint in deteriorated housing and that the existing sanitary codes were being ignored. And this brought him to the conclusion that lead poisoning is not just a disease, but it's a crime. Now, while Dr. Klein urged that crimes be addressed, be prosecuted if necessary, he asked us to dig even deeper, and concluding that the stress should be on changing society. So children's lives and brains are more valued than landlords' financial well-being. And now, 40 years later, I want to share with you how I've kind of processed and come to understand that logic. And it would be in these four basic statements. The first is always aim for prevention, because prevention trumps treatment. And now, while this now seems pretty self-evident to me and probably to a number of you in the room, the fact is that in Canada and in the United States, we continue to spend far, far more money on disease treatment and management than on prevention. And I'm impressed that the Dean report has done such a good job of bringing the issue of prevention to the forefront. Second part of this logic is that we have to search for the most basic underlying causes of injury and illness. And the third point is that we've got to find ways of intervening in the most potent ways possible to address these causes. Prevention is much more than public health science and professional competence. It requires engagement in the politics of organizational behavior and social change. And this means using the full spectrum of tools ranging all the way from the persuasion that goes along with education and technical assistance to the force that goes along with regulation and enforcement. And then the fourth part of the logic is the need to evaluate whatever interventions we've conceived of and have tried. And I really can't say this any better than the Dean report did itself. There are no single levers or changes that would affect significant improvements on their own. The panel made an effort to find the best mix of high-value opportunities for change. These opportunities touch on the continuum of prevention and enforcement activities, from education in schools and proactive prevention initiatives right through to the need for effective enforcement in situations where safety standards are breached. Now, I can't say it any better than that, but Dr. Alice Hamilton, who is certainly the mother of occupational medicine in the United States and has had impact in Canada as well, I'm sure, did say it more eloquently, a little less specifically, but she said this: "I shall always be thankful for the training and scientific method I had, but I've never doubted the wisdom of my decision to give it up and devote myself to work which has been scientific only in part, but human and practical in greater measure." So let me move on to the second general theme that I pull out of the Dean report, which is the changing workforce. So with prevention as a primary objective, I think we can turn to the question of what it is that we need to be preventing. What are the workplace problems that are in front of us today and are most important, and whether or not we're organized to meet these problems effectively. Now, in 1974, in 1971, I described to you I was at Boston City Hospital. I was thinking about becoming a pediatrician. I shifted my whole frame of reference to prevention. And in 1974, I was in Detroit, and I enrolled in a night course in industrial hygiene at Wayne State University. And the professor began the class by explaining to us that workplaces had become so much safer and healthier during his 50-year career that the study of industrial hygiene had become largely a study of history. And he basically introduced this as a history course. I was astonished by the notion that we could pronounce occupational health a mission accomplished. After all, the U.S. Congress had just declared that injuries and illnesses arising out of work situations impose a substantial burden, and that new authority for regulation and enforcement was necessary to address this national problem. And anyone walking into a foundry just a few blocks away from the classroom could see workers struggling through clouds of silica dust. Anyone entering a textile mill would soon be choking on clouds of cotton dust. And official statistics still recorded at least 14 or 15,000 workplace deaths every year in the United States, and that was just including the deaths from traumatic injury, not counting the deaths from occupational illness at all. So I was kind of upset leaving this class. But, over the years, I've actually come to acknowledge that my professor, in an important regard, was correct, and that it was entirely appropriate for him to be proud of the improvement in working conditions during the period that he had worked as a professional. Indeed, in 1970, 1971, compared to 1920, there were far fewer workplace deaths. Lead poisoning cases were decreasing, notably. There were fewer workplace amputations, all signs of some real success. So he was not entirely wrong, but he did have a fault in his logic. And his fault was an inadequate recognition that significant new problems had been growing alongside those that had been receding. That the problems had been changing, but were no less important. Metalworking fluids had been shifting from mineral oils to synthetics. There was less underground and more strip mining. The years had seen phenomenal growth in the petrochemical industry, with new hazards unheard of 50 years earlier. And science was revealing illness from exposure to well-known hazards such as lead and arsenic and silica at levels far lower than those that had been associated previously with disease. So this is a paradox, and it is this paradox of simultaneously success and failure that I think has been pretty elegantly articulated, or was, back in 1959 by René Dubos in his book titled The Mirage of Health, which I would still recommend to anybody here as being appropriate to the current environment. This is what Dubos said. He said, as long as mankind is made up of independent individuals with free will, there cannot be any social status quo. Men will, this is 1959 he was writing this, men will develop new urges, and these will give rise to new problems, which will require ever new solutions. Human life implies adventure, and there is no adventure without struggles and dangers. So now in 2012, after my own 40-year career, part of me is tempted to repeat what I was taught about success in that industrial hygiene class. Because indeed, over the past 40 years that I've been actively engaged in the field, we've seen notable improvements. When I started work in 1974 with the United Automobile Workers, we established a least wanted list of hazardous chemical exposures. And I can say with some pride that there's been significant progress in both Canada and the U.S. with regard to most of those. Lead, cutting fluids, formaldehyde, silica. It's something to be proud about. But while some pride in these accomplishments is warranted, I think it's more important to keep in mind what Dubos said about new problems that will require new solutions. Carl Jung, the noted Swiss psychiatrist, put it this way. He said, through pride, we are ever deceiving ourselves. But deep down, below the surface of the average conscience, is a still, small voice that says to us, something is out of tune. So I would ask you, and I've asked myself, what is it in 2012 that is now out of tune that we need to address? Because I think an understanding of that is what's going to guide a younger profession of safety and health professionals and labor and management representatives in the work that they're going to be doing over the next 50 years. So I want to share with you what are some of the new challenges and opportunities that I think we hardly imagined just a generation ago. The first is that the average worker today is older, is heavier, and much more likely to have one or more chronic health conditions like diabetes or high blood pressure. And the risk of workplace injury increases with all these changes. Worker compensation rates, for example, increase with worker weight, and workplace fatality rates increase with age, although I've got to say that non-fatal injuries among older workers occurred at a lower rate than among younger workers. But when older workers get hurt, they're more likely to die. And a recent article by Peter Smith and colleagues here at the Institute for Work and Health found elevated risks of work-related injuries and repetitive strain disorders among workers with 5 different chronic health conditions: high blood pressure, heart disease, arthritis, back problems, and diabetes, with some exceptions. For example, diabetes was associated with work-related repetitive strain injury in women, but not men. But there are clear relationships between these facets of an aging society with the way that risks at the workplace play themselves out. Also, new chemicals are being introduced into workplaces every day without testing for possible toxic effects on workers, everything from exotic chemotherapy drugs that healthcare workers are exposed to nanoparticles that are becoming commonplace in a whole variety of new industries. And of course, it's by now pretty well established that work-related musculoskeletal disorders, and I'm talking about those that are not associated with slips, trips, falls, or motor vehicle accidents, but it's pretty well established, and has been for a number of years, that these disorders are the leading cause in the cost of worker compensation claims. And our administrative, our regulatory enforcement systems have simply not kept up with that fact. And the structural changes in our labor markets are as striking as the changed pattern of hazards and injuries and illnesses. I think the most obvious is the shift from manufacturing and construction to services and healthcare. But I think it's also true that even when our recent economic crises are overcome and jobs become more plentiful again, manufacturing in particular is going to be much different than it was even 20 years ago. With less unskilled or semi-skilled manual labor and more workplaces where jobs require the skills to operate and maintain robotics and other forms of high-tech automation. And with regard to the labor markets, new waves of immigrants are going to continue to come to our shores and find work, and they'll find work in the most dangerous jobs. A recent review of data by Washington State found that Latino workers not only have higher rates of work-related traumatic injuries than other workers, but that even after controlling for Latino representation in the workforce, the disparity has been increasing. So you can see on the chart that's on the left that the blue arrow is pointing to the slow growth in numbers or percent of Latinos in the workforce, and the red line is pointing to the percent of Latinos among those who have work-related injuries, and you can see that the gap between those two lines has been growing. The disparity is becoming greater. Probably a combined effect related to disproportionate employment in highly hazardous jobs, and also especially high injury rates for Latinos in those jobs. We don't fully understand this, but this is what the data shows. Now, new terms of employment are rapidly replacing traditional opportunities. This is another feature of the labor market, which we've got to keep in mind and address in some way. New terms of employment are rapidly replacing traditional opportunities for lifetime employment with benefits to jobs that are so different that we don't even have a common vocabulary to describe them. We find ourselves talking about contingent workers, insecure, temporary, casual, seasonal, contracted, home-based, precarious, or marginal work, and we don't fully understand the consequences of these changes. Research is beginning to show, however, that these non-traditional workers have higher rates, frequencies, and costs of worker compensation claims than their permanent counterparts in the same types of work. This bar chart simply shows in a wide range of different industry groups that in every case, temporary workers have higher rates and costs than comparable workers alongside them in the same industries. Another notable labor market change, at least in the U.S., is union representation, which has dropped from 20% in 1983 to just about 12% in 2011, a loss of almost 50% in less than 30 years. And if you go back to, of course, the 1930s and 40s, the rates of unionization were even higher. Union representation in Canada, of course, is much higher than it is in the U.S., and I think that still 30% of non-agricultural workers were unionized in 2011, and the rates have been reasonably stable compared to what's been happening in the U.S. And then finally, our expectations about appropriate interpersonal behavior at work have been changing, with less tolerance for things like workplace violence, including bullying, sexual harassment, and other forms of discriminatory treatment, along with increasing protection for whistleblowers who bring these problems out into the open. So as our expectations change, the attention that we pay in our professional programs and our research programs has to change along with those. So these are some of the features of a changing world of work. And I just have to note, though, that while a lot of our attention has to go to these changes, there are some very significant and stubborn problems that we have simply failed to address adequately over the past 30, 40, 50, or 60 years. There are still workers who are dying on a regular basis following entry into a confined space, particularly rescue workers who are trying to do the right thing and end up the victim themselves. Falls from heights are continuing to be one of the highest causes of workplace fatalities. Okay, so I want to go on now, shift gears a little bit, and talk about the third theme, which has to do with government not being able to be in every workplace, even if it was the right thing to do. So while these new exposures, risks, and labor market arrangements have emerged, I'm going to argue, that our public systems of regulation, enforcement, and education have remained essentially unchanged since the early 1970s. The OSHA Act in the U.S. and the Occupational Safety and Health Act here are both designed around a conventional paradigm of the exercise of state power in a democracy. A set of mandatory rules establishes a minimum acceptable level of performance. Employers are expected to understand and comply with these rules, and they're then held accountable if and when the government uses its police authority to inspect workplaces and enforce the law. And then there are a variety of consultation and education services are provided to encourage voluntary compliance. Now, the framework rests on the premise that market incentives for reducing hazards are imperfect and that they must be supplemented with things like inspections and penalties, the threat of inspections and penalties, and the incentives of education and consultation. And I believe that premise is essentially sound. And there's some evidence that major rules that have gone into effect, including those for inorganic lead and cotton dust, coke ovens, bloodborne pathogens, that these have all, in fact, resulted in reduced exposure to hazards. And several studies have found a direct and positive impact of enforcement in workplaces where inspections have taken place. Most notable are 3 studies that have been published in the last year or so, one in California, one in the state of Washington, and most recently in the state of Pennsylvania, all of which show that where enforcement inspections for safety and health compliance have taken place, that in the following 1 or 2 years after the inspections, there have been greater declines in worker compensation cases and in workplace injuries than in comparable workplaces where the inspections haven't taken place. In Washington and in Pennsylvania, the impact was greatest where the inspections resulted in citations and penalties. This is just one table from the study from the state of Washington. And the set of bars on the left-hand side are for inspections in fixed-site industry, so mostly manufacturing workplaces. On the right side, these are results for non-fixed industry, so this might be construction or agriculture. In each case, the blue bar shows what was happening with worker compensation claims rates in companies that were not inspected or had no consultation in a period of time before the study. And you'll see that there was a slight decrease in worker compensation rates in even workplaces that had no government engagement. The green bar shows what happened when inspections were done but no penalties were issued. And the red bar shows what happened when inspections were done and there were citations and monetary penalties. A decrease of about 20% greater than where there was no government involvement. Basically the same results were found in Pennsylvania, where the study looked at federal OSHA inspections in manufacturing facilities and found it was between a 19 and 24% greater decline in reported injuries in the 2 years following the inspections than in a comparable group of manufacturing workplaces where no inspections had been done. Now, a similar study has been done recently and published of Ontario inspections by Sheila Hogue Johnson and colleagues here at the Institute, and recently published in Journal of Occupational Environmental Medicine. And the study here in Ontario did not have similar positive results. And Dr. Mustard here at the Institute has prepared a very nice summary that I'm sure some of you have seen in comparison of three studies, the California study, the Washington study, and the Ontario study, including possible reasons that the Ontario results differ from the other two. And this is an area I think that still merits a lot of thought and consideration because the results really are different, and there's no reason to believe that the impact of enforcement inspections would be different in different localities. So there may be differences in the way that the inspection programs actually operate. There may be some technical differences in the way that the study groups were designed and the work sites that studied were chosen. There's evidence, by the way, that at least in Washington state, that safety and health inspections not only result in the prevention of injuries, but that the savings in claims costs pay for the administrative costs of the program. And there's almost a dollar-for-dollar match between the amount of money saved by the reduced injuries. You just calculate the cost of an average worker comp claim. It's just arithmetic. You multiply that out, and it almost identically equals the full budget of the state OSHA program in Washington. Well, notwithstanding this kind of evidence for the effectiveness and the impact of our government safety and health programs over the last 40 years, I think there are reasons to be less than fully satisfied. Because while there is considerable evidence that inspections have a positive impact on workplaces inspected, the evidence for a more widespread rippling impact, a deterrent impact that goes beyond the workplaces inspected, the evidence for that has not been very encouraging. Also, workers continue to be killed by hazards for which inexpensive protective measures have been available and well recognized for hundreds and in some cases even thousands of years. And I'll give you my favorite example, which is fatalities from collapsed trenches or excavation sites. Every week, one or more workers are killed in the United States from trench catastrophes, despite the fact that nearly 2,500 years ago, Herodotus reported that in his history of the Persian Wars that the Phoenician army had figured out that by making the top of a trench wider than the bottom of it, collapses wouldn't happen. And that's one of the three methods right now that's been written into our requirements for trench protection. Sloping the sides is one, shoring and trench boxes are the other two. But despite the fact that the knowledge has been known for 2,500 years, the methods are inexpensive, technically simple, and there are now requirements in place, legal requirements to do these things, we still are experiencing trench fatalities every week of the year. I will point out that those are not photographs that I somehow found from the Persian Wars. That's World War II. And I did check to see whether or not the Phoenicians were particularly effective in their military affairs. They were on the losing side in the war, but they didn't die from the trenches. They were just not very good soldiers. Also, with regard to the kinds of places that were coming up a little bit short, risks and protections from workplace hazards are spread unevenly and, I would argue, unfairly. As noted earlier, temporary, leased, other contingent workers experience higher rates of worker compensation claims than their permanent counterparts in same industries. And to go on, the regulatory system has been gridlocked on even the most obvious needs. With over 70,000 chemicals in commercial use in the U.S., OSHA has adopted comprehensive rules protecting workers from exposure to only 33 of these in nearly 40 years of work. And obsolete exposure limits for another 450 chemicals, sometimes dating back to the 1950s, have not been updated. And then as a last point, in the United States, following what some of you know about this history, but following the repeals of the federal OSHA and the Washington state ergonomics rules, there has been no effective strategy in place to reduce work-related musculoskeletal disorders, which, as I mentioned earlier, remain at about 35% of the claims and 40% of the costs in the system. So what I'm describing here is what I would argue to be a limited effectiveness of systems that have had notable successes. And the limited effectiveness, I think, is not surprising given the basic design of our national and our state and provincial systems. So here's how I would describe the system that's in place. First of all, in both the U.S. and in Canada, a very small group of inspectors is deployed to a very large number of workplaces, one at a time. At current levels, it would take federal OSHA 133 years to inspect each workplace under its jurisdiction just one time. In Ontario, the frequency is better, especially since the Ministry of Labour doubled the number of inspectors back in, 2004. But the inspection strategy and resources still make it pretty unlikely that most employers will see an inspector for many, many years at a time. Yes, that's just a design feature. Secondly, the consequences of getting caught breaking the law don't have the deterrent effect that I think was intended by the legislators when the laws were written. The maximum penalty for a serious OSHA violation in the United States, and that's one for which there is a substantial probability of death or serious physical harm. The maximum penalty is only $7,000. And written into the law is a formula that then takes into account various factors that would lower the actual penalty from the maximum. So a small workplace gets a reduction. If there hasn't been a previous inspection and fine, there's a reduction, et cetera, so that the average penalty for a serious violation was only about $1,500. Now, you can compare this. Here's the most striking example. Well, actually, I'll give you one example first, and then the most striking. The first one is striking enough. You compare the $1,500 for a serious violation with $325,000 for indecent conduct on our airwaves. Okay. But the example that's even more striking than that is an explosion that took place in Connecticut just a few years ago of a sulfuric acid tank not Connecticut, it was in Delaware. But this was an explosion that killed one worker, and it killed lots of fish and crabs. The OSHA penalty was, for OSHA, very high. The OSHA penalty was $175,000. But the EPA, Environmental Protection Agency, penalty for killing the fish was $10 million. So put yourself in the mindset of an employer who is going to be complying with both sets of regulations, and it's clear where the emphasis is likely to go and the resources. That I'm not going to talk about. Third point is that regulating exposure to one hazard at a time, which is the way that we generally approach things, is hopelessly inadequate given the vast number of chemicals and other hazards in the workplace and the bureaucratic difficulties in rulemaking. And then fourth, compliance with safety and health rules is built on a catch-me-if-you-can kind of approach. Employers are expected to comply with the rules, and they're held accountable only after the fact, if and when an inspector shows up and finds something. And given the low frequency of inspections, the low penalties, and the nature of this honor system, it's not surprising that most workplaces, when they are inspected, even if they're just randomly chosen, not on a high hazard list, most workplaces are not fully compliant with the safety and health rules. Approximately 65% of OSHA inspections in the U.S. result in at least one violation being cited. And in Ontario in 2009 to 2010, there were about 88,000 total field visits, including inspections, investigations, and consultations. And these visits resulted in 139,000, almost 140,000 written orders to correct violations that were found. So an after-the-fact system is not the most effective and efficient. And then fifth, the acts were written when employees were much more likely than they are today, as I mentioned earlier, to hold a long-term job with a single stable employer and be represented by a union. Today's employment landscape, characterized by transnational businesses, global outsourcing, contingent employment, independent contracting, a shadow economy of underground business enterprises, all of this makes it much more difficult to find the kinds of workplaces for which the acts were written, and even to identify employers who can be held accountable under the current laws. So the current system, while having had some successes, has some notable glitches. And what I'd like to do now is to shift and present to you a different approach, an alternate paradigm, if you will. One that I've got to acknowledge right at the outset is something that a lot of my friends and colleagues in the U.S. don't like, but may actually be a bit better received in Canadian provinces, which are closer to having some of the elements already in place. And the model that I want to describe to you has three elements. There are 5 bullets, but I think there are 3 elements. The first is that all employers would be required to implement a comprehensive safety and health program with elements including management commitment, employee participation, training, exposure assessment, hazard control, and medical surveillance. Now that listing of elements I think is familiar to a number of you for a couple of reasons. One is that OSHA in the U.S. has had voluntary guidelines for such programs in place since 1989, but has been unable to make them mandatory despite several efforts at rulemaking. And I'll come back to relating that to Canada and Ontario in a couple of minutes. But I believe that programs like this only really make sense if at their heart is a requirement for actually finding and fixing hazards, with written documentation for what hazards were found, plans for fixing them, and timetables for doing so. And I think this would address to some degree the Dean panel's proposal for better methods of gathering and sharing information so that everyone involved can better track the performance of workplaces. I really can't think of any better way to measure performance than evidence that an organization has identified hazards that are known to be associated with injuries and illnesses and has taken steps to eliminate them. Unlike worker compensation claims that trail after injuries have occurred, hazard identification would be a leading indicator for directing attention to prevention. I know that there's been a lot of discussion about leading indicators and trailing indicators here in Ontario. I would direct your attention to a recent working paper on the subject that Dr. Ben Amick, who isn't here today, has prepared. And he reports a possible way to predict health and safety performance by assessing the quality of a firm's internal responsibility system. The second part of this paradigm, beyond just requiring comprehensive health and safety programs, would be that every workplace would be required to obtain an annual or periodic certification that its program was sound, that in fact it was being implemented and that it was in compliance with the requirements. Business owners would sign a personal declaration of compliance and have some liability in the event of acts of negligence or willful disregard of the law. Third, the role of government agencies under this kind of a paradigm would have to change, because there's no way that any government agency could inspect and certify every workplace with any reasonable frequency. So the agencies would need to engage non-government individuals or organizations for the inspection and certification process. Here's where my friends in the U.S., particularly in organized labor, jump off the boat, because this sounds like privatizing essential government services. The private sector inspectors would be licensed and operate under rules established by the government. The government agencies would audit the inspectors, continue to do their own inspections for when there were complaints or fatalities or catastrophes, and there would have to be very strong checks and balances to avoid what are well-known dangers from the conflicts of interest or frank corruption that become possible when government delegates functions to the private sector. So among the important questions requiring some real thought and good answers would be, who pays the private inspectors, and how would their independence be ensured? Or would the results of certification inspections be publicly available or discoverable in legal proceedings? Very thorny questions. But the fact is that this approach that I just described while it's generally seen as unworkable or unacceptable by a lot of safety and health folks in the United States, variations of it already exist and have existed for years and operate pretty effectively. Construction and maritime crane certification under some state OSHA programs is done by private inspectors who operate under the auspices of state government. Pressure vessel inspections are often done by insurance companies to meet government requirements. Hospital accreditation in the U.S. is done by the private Joint Commission on Accreditation of Healthcare Organizations. And private persons are designated, this is the one that amazes me most, private persons are designated to inspect aircrafts on behalf of the Federal Aviation Administration in the U.S., but under a series of checks and balances. So what I'm suggesting here is not as outlandish as it might first appear. And of course, more of the elements are already in place or under consideration in Ontario than any place in the U.S. Under the Ontario Occupational Health and Safety Act, an employer is already required to prepare a written occupational safety and health policy and must develop and maintain a program to implement that policy. The ministry has published pretty good guidance documents about model policies and programs. For example, a policy statement, according to the guidance, should reflect management commitment to and support for the protection of workers, and the statement should be signed by the highest level of management at the workplace. However, I would argue, just from what I've seen, and I may not know the whole picture, it seems to me that the statutory and regulatory requirements for these policies and programs in Ontario remain pretty general and are probably very difficult to enforce consistently. Also, here in Ontario, at least one management and one worker member of the Joint Safety and Health Committee must be trained and certified. And the Dean report notes that the Workplace Safety and Insurance Board has the authority to develop standards for the accreditation of employers who adopt health and safety policies. I'm quoting now from the report. Authority to develop standards for the accreditation of employers who adopt health and safety policies and operate successful health and safety programs. And it also recommends that accreditation should be a responsibility of the new prevention organization, and that an accreditation program should be developed with participation of both employer and labor stakeholders. So it's another element of this paradigm that is right there within reach here. And then Ontario has a much more highly developed internal responsibility system than any jurisdiction in the United States, including the direct responsibility that officers of a corporation have for health and safety and what I think of as a meaningfully empowered Joint Health and Safety Committee. So I want to move on now to the fourth theme that I started out with, and this is the theme about the need for evidence-based change. And to do that, I want to come back to the opening points that I made about preventing workplace injuries and illnesses. Prevention trumps treatment. Need to search for the most basic underlying causes, intervene in the most potent ways, and evaluate whether or not the intervention worked. And it was gratifying to me that the Dean report called for a common database for planning and evaluation and advised that the system partners and stakeholders use the data for practical purposes. Because step 2 here, searching, and step 4, evaluating, both require exactly that, gathering and analyzing data to turn raw information into evidence that can actually guide action. Now, I don't have time to discuss what would make for an interesting conversation, which would be to distinguish between scientific assessment of data from less reliable, quick and dirty look at data. to make sense out of numbers. I will mention quickly, though, that you can't rely on common sense. Common sense, after all, is what tells you that the Earth is flat. So I would go a little bit beyond that. Before finishing, though, I want to make a few points about scientific strategy. We need to think, as I've said already a couple of times, we need to think beyond the question of what causes disease or injury to what it is that causes exposure. The most potent interventions are going to be those that get most directly at the deepest underlying causes. There's been a lot of attention in the U.S., and it's probably true in Canada as well, to what have been called behavioral safety programs that tend to make me very nervous. I'm reluctant to stop the search for causation at worker behavior, unless we're talking about behavior at a very high executive level that determines action at the lower levels. The logic that I like was expressed well by Dr. Alphonse Chapanis, who probably maybe one or two of you in the room have heard of. Not a very famous guy, but a true visionary in the fields of human factors engineering and workplace ergonomics, whose accomplishments range from the safe design of aircraft cockpits to the effective design of safety labeling. Chapanis said this: "Everyone, and that includes you and me, is at some time careless, complacent, overconfident, and stubborn." Recognize yourself? At times, each of us becomes distracted, inattentive, bored, and fatigued. We occasionally take chances. We misunderstand, we misinterpret, and we misread. And as a result of these and still other completely human characteristics, we sometimes do not do things or use things in the ways they are expected of us. And he goes on to say that because we're human, and because all these traits are fundamental and built into each of us, the equipment, machines, and systems that we construct for our use have to be made to accommodate us the way we are and not vice versa. So, assuming this kind of posture about where to place the energy, at what level to look for information and for change, I think it's important also to understand that evidence, while being necessary for rational decision-making, that evidence is necessary, but it's not sufficient. There are lots of examples where the evidence is very clear and compelling, but the problems persist. I gave you the example of the trench fatalities. That's my favorite example, but there are lots of others. I'll give you one other quickly, and that would be around the issue of workplace violence in mental hospitals. The evidence about the control of workplace violence is pretty straightforward. Mental health workers can be protected if potentially violent patients are either restrained chemically or physically. But restraining patients might be considered abusive treatment depending on how you balance two different value systems: patient rights and worker rights. And when all the parties concerned with mental health programs get together, families, unions, trial lawyers, the legislature, the governor, there are many different political agendas at work. So the point that I want to make here is that good public policy takes place not simply as something that flows out of good information, out of science or evidence, but it only takes place at the intersection of evidence together with the values that people bring to the table and the nature of the political process and the political agendas that are in the room. So public policy can't be short-circuited, is what this implies to me. It's always a balance among science, political process, and values. Science provides material for the political battles and clashes of values, but it doesn't circumvent them. Even when the evidence is pretty clear and robust, we can't disentangle science from these other considerations. Policy processes in which scientists talk to scientists and then they pass their conclusions on to decision makers are processes that inevitably fail. They simply marginalize science, increasing the chance that evidence will be misunderstood and misused. So what this means to me, and I would argue to a lot of you, is that we've got to participate not only as scientists, if we're scientists, not just as union representatives, if that's the hat we wear, not just as business executives, but we've got to also participate as people who have values and as citizens with a stake in the political process. Now, I think that you're very fortunate here in the province of Ontario to have a workplace health and safety system that has close links among safety and health policy, safety and health regulation and enforcement, worker compensation, and multidisciplinary research. I'm aware of only one other place in North America where all those components, all those ingredients that go into effective public policy exist in close proximity, and that would be in the state of Washington when all this is in the Department of Labor and Industries. But here in Ontario, I would argue that you have an additional advantage because stakeholders are much more closely and formally tied into the system than is the case any place in the U.S. through your associations, your safety and health committees, your new prevention council. Now let me draw this to conclusion just by adding a couple of quick incidental points that I didn't want to just leave out completely, but I'm going to touch on very, very quickly. I organized this talk around what I felt were 4 key points in the Dean panel report. But there are several others that deserve at least quick mention, and I want to run through very, very quickly without any time for discussion. One of those is the conviction that success is dependent on the continued participation of labor and employer stakeholders. Next is the need to add some administrative monetary penalties as an enforcement tool. I think there's evidence to support that. The third would be a multi-year social awareness strategy to reduce public tolerance of workplace injury and illness. Next would be mandatory training for all workers and supervisors, and specifically for entry-level construction workers and workers at risk for falls from heights. The next would be a province-wide strategy on the underground economy, and then better protection for vulnerable workers. I think I could have delivered an entire talk just on those things. So that brings me to just a couple of brief final comments. I think here in Ontario, the public and private partners have been given great opportunities and authority under the law, but it's important to recognize that this is accompanied by an enormous responsibility. And that responsibility, I think, has been best articulated by Malcolm Sparrow, who's now at the Kennedy School, in his book, The Regulatory Craft, which I believe some of you here are familiar with. But this is what Sparrow says. Society entrusts regulatory and enforcement agencies with awesome powers. Awesome powers. They can impose economic penalties, place liens upon or seize property, limit business practices, suspend professional licenses, destroy livelihoods. So it's how the regulatory and enforcement agencies use these awesome powers that fundamentally affects the nature and quality of life in a democracy. So yeah, we've got great opportunities, interesting challenges, but tremendous responsibility. See, I think he was right. I think Sparrow was right, that success depends on how authority is exercised. And this means a constant balancing act. Finding and fixing workplace hazards means rejecting the idea that accidents are inevitable byproducts of work, and insisting instead that injuries and illnesses are predictable and preventable. It means sometimes acting aggressively in the face of uncertainty when worker lives are at stake. Yet it also means constant checks and balances to ensure that the use of state power doesn't turn to abuse, and that the bar for fairness, accountability, and ethics is set very, very high. I think that you have the vision and the determination to find the right balance here in the province, and I really not only appreciate the ability to come and share ideas with you, but I look forward to learning of your successes over the coming months and years. And with that, I thank you very much, and if there's room for questions, I'd I don't know what the time is. I haven't checked it, but thank you.